Good morning, everybody.
Good morning.
My name is Sarah Kelly Palmer.
And I'm Kayla David.
Welcome, everyone, this morning. And for those of you who it's your first time joining us, Kayla and I work at Family Service of Rhode Island in the Healing Department. And we come together here on Facebook as part of our Be Well Live information series, where we talk about lots of different topics related to our health and wellness, particularly during the COVID-19 crisis. Family Service of Rhode Island, or FSRI as we call it, is a social service agency that has been serving Rhode Island for over 125 years. And we offer a wide variety of programs, including telehealth counseling, which is so important as we continue to grapple with our new reality of COVID-19.
Yes, and as Sarah said, we join together today and every other Wednesday at 10 a.m. for discussions related to supporting wellness during COVID-19. We ask that you please take a moment to share this with your friends or to start a watch party. You can watch us on Facebook, but also on YouTube. And we really want to get this information out, and we ask you to help us to share this information about being well during COVID-19. Now more than ever, especially since we're seeing, increases in numbers as we're coming into the fall, it's important for us to be able to reach out if we're struggling or to help loved ones be able to connect to assistance if they're struggling. COVID-19 has put a tremendous amount of stress on all of us in so many different ways, and it's impacting our well-being as well as our mental health.
So, Kayla, here on Be Well, we've talked about a lot of different impacts that COVID-19 has had. And we've talked about different groups that it's had an impact on. And today we are going to talk about a particularly vulnerable group. Some of the hardest hit by COVID-19 have been our elders, with nursing homes shutting down and limiting visitors, with seniors living on their own, becoming more isolated because they can't really leave the house because of the health risk, and the overall vulnerability of elders contracting COVID-19, right? We know that they're one of the highest risk groups to contract the virus. The pandemic has really just increased social isolation for our elders, which we know is one of the greatest risk factors for elder abuse.
Yes.
Approximately 1 in 10 Americans over the age of 60 have experienced some form of elder abuse. And one study has actually estimated that only 1 in 14 of elder abuse cases are actually reported to the authorities.
Mm-hmm.
Within the context of COVID-19, many experts say that those numbers are only increasing.
Joining us today to discuss elder abuse and what we can do as a community to combat this is Cheryl, Patnaude, and Candace, Johndrow. Welcome.
Hi, Cheryl. Hi, Candace.
And Cheryl, did I get your last name right? I'm so sorry.
It's fine. Patnaude.
Patnaude.
Patnaude. Okay, good.
There are bigger things to address.
So Cheryl is an elder justice advocate for St. Ellizabeth's Haven for elder justice. And then we have Candace Johndrow, who is the director of victim services at Family Service of Rhode Island. Thank you both for joining us today.
Thanks for having us.
Absolutely. It's great to be here. Thank you.
Elder abuse is one of those things that people don't want to think about or talk about, which in turn makes it more likely to happen. Can you tell us a little bit about what elder abuse looks like, Cheryl?
Sure. And I think your point is well taken. Elder abuse, like many other forms of abuse, is something that typically happens in isolation. The larger community doesn't think about abuse happening. They think about it happening, somewhere else or by a certain group of populations. But what we know is that abuse crosses all demographics, all races, all ages, etc. So for us, when we talk about elder abuse, we're looking specifically at elder victims of physical abuse, financial exploitation, isolation, self-neglect, verbal abuse, bullying, emotional abuse, and it just, it kind of goes on. And similar to when you think about abuse of other populations, for example, abuse of children.
Mm-hmm.
It's the same types of categories, if you will.
And Cheryl, I know that I mentioned in the opening that social isolation is one of the big risk factors for elder abuse to occur. Can you talk a little bit about how COVID-19 has impacted and affected the risk for elder abuse in our seniors?
Sure, absolutely. So the number one risk for elders who are housebound, self-quarantining, is isolation. So if someone has been living alone, they're now completely isolated. For someone to come into their home isn't an option, because if you have someone coming into your home, for example, for home care, they're exposing you potentially to COVID. And so typically, as we all know, people have to quarantine for 14 days if they've been exposed. Many home care providers don't know if they've been exposed. So the isolation is a huge problem. The other huge issue that we see is that for elders, victims of abuse who live with their abuser, for example, are significantly more at risk for abuse because of the isolation, because of the tensions that happen when people are living in close quarters, when they can't go out, when there's no one or no way to get help at your senior center, for example. So I think certainly the two biggest factors that put elders at risk right now during COVID are the isolation and lack of access to resources.
Yeah, and I think COVID has stressed us all out. So I think your point about living in close quarters and layering the kind of stress and anxiety and worry that this pandemic has put on all of us, I can only imagine that could really be a tipping point for some people to have that abuse happen.
Yes, and I think, or at least we know, one of the other challenges that we, as service providers to elder victims of abuse, is that during this entire COVID crisis, no one, if you will, is looking about or thinking about or providing resources in a public way for elder victims of abuse. So, whether it's a press conference, a newspaper article, etc., we're not we're not including elder victims. We're looking at, victims of domestic violence, but certainly not victims of elder abuse. And so we're not identifying it, not talking about resources. We're not looking at the risk factors. So it's not only an isolated population, but it's also become a hidden population.
Well, here in our state, we have a victim service provider steering committee, of which, Candace, you are one of the co-chairs. Can you share with us a little bit about the steering committee and how victim service providers across our state are responding to the needs or this need of kind of bringing awareness to elder victims and elder abuse?
Sure. So the Rhode Island Crime Victim Service Provider Steering Committee has been around for many years, and we've been very fortunate over the past few years for the committee to have grown significantly. We have representatives from 20 to 30 victim service provider organizations on the committee, as well as officials from government agencies that have victim-focused programs or benefits available. We have members of the legal community represented, law enforcement, military, etc. So it's really grown by leaps and bounds, and it's a way, it's a venue for folks who have a common purpose to get together on a regular basis to talk about what's going on in our state, emerging trends, resources that are available for providers to be able to do more for victims of all types of crime. And we also come together to talk about training for providers specifically, those folks who have direct contact with individuals who have been victimized, and how can we get them best practice information from experts known locally, regionally, nationally, etc. So the group helps to coordinate some of those activities. And also recently, we put together a resource guide of various victim services that or victim supports that are available. So there's a lot I could talk about. I don't want to jump around all over the place. But as it relates to elder abuse specifically, Cheryl is on our committee, which is wonderful. So we as a group are learning more about the needs of elders in our community statewide across Rhode Island, because as she said, I think even amongst providers themselves, if you aren't specifically focused on elder populations, and you might be one who typically works to support children or to support specific victims of sexual assault, etc., you know, you might not be thinking so much about elders. So Cheryl and her crew has done a lot to help us better understand those issues, what's available, and to bring experts to our various training venues so that we can all collectively learn more about what is happening.
Thank you, Candace. And I think I'm so glad we're talking about this topic today, because as you know, both you and Cheryl are saying, there hasn't been a light that's been shining on this topic, I think, in, statewide since COVID hit. So I'm really glad that we are kind of taking this topic on today so that we can help raise awareness, especially during this time. Because we know that since the beginning of us quarantining and us shutting down, that our elders have really been the most impacted from isolation, as Cheryl had talked about. Everything from, isolation to some seniors not even being able to find shelter for those who need it. So there's been a whole host of things that have disproportionately impacted seniors. Cheryl, I wonder if you can share about what you believe that seniors are struggling with the most during this specific time of COVID.
Sure. So I think, of course, as we already talked about, isolation. For those living in long-term care settings, of course, they haven't seen family members for months and months and months. They've been provided with technology, but many folks are not able or comfortable with technology or able to operate it. For example, in our facilities, if an elder goes to the hospital for whatever reason, when they come back to the facility, they're in isolation for 14 days. So they're by themselves. They're not seeing anyone. They're not eating communally. And then in terms of the community, I think several of the biggest losses which contribute to isolation is that they're not able to access any transportation. They're not able to access their local senior center, where they often provide meals twice a day, never mind the social aspect of it. They're not able to access Meals on Wheels, which is a home meal delivery program, unless there are volunteers who are willing to, kind of take that risk. They're isolated from folks being able to help them with grocery shopping. Another major area that we have seen is that elders don't have access to the traditional medical services that we will experience. So instead of being able to go to care physician or their cardiologist or specialist, for example, it's now telemedicine. So basically it becomes, so-and-so, how are you doing? Well, I'm having, this and this and this. And there's just there's no human contact. And it's difficult for communication. And so I think it's difficult, one, again, to access the means in which you can have telecommunication. And oftentimes we all know that if we experience some type of injury, for example, or something that's, not necessarily a critical life and death situation, we have the emergency room for treatment. That's not happening.
Right.
And in terms of healthcare, triage happens. So oftentimes elders kind of fall to the bottom of the list because it may not be a life-threatening event. And so first responders are having to prioritize which. But again, it's it's the lack of resources, the lack of access to resources, and just turning their world upside down in terms of their daily routine.
I would imagine too, Cheryl, if I could just interject, that if you are living at home with your abuser and you're limited to telehealth to the degree that you have the capacity and ability to navigate that venue, that, normally a physician or someone whom you are able to have a private interaction with, you could speak to maybe openly to the degree you were comfortable about whether you were safe at home. And I imagine you're very limited in your ability to be able to do that if the person abusing you is right there in the next room,
Exactly. And the isolation also contributes perhaps to someone else, like a senior center staff person who's known, trusted by the elder, but who senses that something is off. So when they're able to access the traditional services that are part of their daily routine, if a staff member, for example, notices that something seems amiss with the elder, or they notice perhaps a bruise, or that the person's losing weight, or any of those kinds of signs and symptoms, you're able to have a safe, confidential conversation, and that doesn't happen.
It makes
right now.
Yeah, it makes me think, Cheryl, about, we've heard a lot about that, about kids and the worry of kids not going back to school and not, catching the abuse or food insecurity or all of those things. But we have not heard the same kind of outcry about seniors not having access to their daily activities that they normally would.
Right.
It's such a good point to make, because then that risk just increases even more for that elder abuse.
Yes, and that spills over into our community collaborators, because, for example, the Office of Healthy Aging, which many folks may know that their former name was Department of Elderly Affairs. So they're the mandated agency that everyone in Rhode Island is mandated to report suspicions of or knowledge of abuse. And typically what happens is those calls, reports get triaged, and if it is an abuse case, then abuse investigators go out immediately. However, like pretty much the rest of the world, they are working from home, and because of the lack of protective gear and so forth, they are not able to go to the home immediately for whom the abuse is suspected. So they send a first responder. But again, first responder, I wouldn't be able to do a first responder's job. And, it's likely that they're not able to, in isolation, do the job that protective services would do. So that's also another way in which, abusers know that, and, if you will, can take advantage of that quite easily. No one's looking. No one's looking. There's no one to tell.
Cheryl, we've talked a lot about kind of changes in services and this need for increased access to services, especially for our seniors. Can you speak a little bit about your organization, which is a resource and is still operating during this time? Just share with the listeners a little bit about what you all are doing and how might people be able to access that?
Sure. So St. Elizabeth Haven for Elder Justice, and I am the Elder Justice Advocate, is a small program of the larger St. Elizabeth community, and they operate nursing homes and day services and so forth. But our particular program offers safe haven, shelter services, if you will, to elder victims of abuse who need a safe place to be. And so that happens through referrals to Office of Healthy Aging, or sometimes a direct call to myself or some other responder. And so we provide short-term shelter, minimum of 30 days, at which point, as soon as the person, and I work starting from the time the referral comes to us, I triage the case, I do the assessments, We do collectively the admissions, and I typically am meeting with the person who comes into shelter either that day or absolutely the next day. We operate 5 days a week. We're not a 24/7 service. And so what happens immediately is that we begin to talk about the abuse and maybe legal resources that need to be pursued, maybe just advocacy, support, discharge planning. Where is this person going to go? And then I also do the same types of services, except for the shelter piece, to elder victims who are living in the community. So our program is sort of a two-tier. We offer protective services, if you will, and a host of other services to elders, both needing to come into shelter and those choosing to stay in the community.
Thank you, Cheryl. I mean, I think it's so important because everything that we're talking about has to do with isolation, and to combat that, we have to talk about connection. I think that there's so many, barriers to us really talking about this, but one of them is that many times people feel like they don't know what to do. I mean, we hear that, no matter what kind of abuse it is, even from providers saying, if I ask the question and someone answers, I don't know what to do. Yes. Let alone if we're talking about people who are just, neighbors or friends or kind of living in the community. So I'm hoping you can speak a little bit to the people that are listening and watching of what they can do to help seniors in their community.
Sure. So I think in terms of perhaps suspecting that, something might be going on, or maybe they see a change in the neighbor's patterns. They may not even know the neighbor. Oftentimes people now don't communicate, verbally. People are kind of doing their thing, and so they may not know neighbors. But I think one of the important things is to, look for and listen to what might be happening. So perhaps you hear arguing. Perhaps you see an elder who's wandering, who maybe shouldn't be out at the time of, day or night. Maybe they're dressed inappropriately for the weather. You don't have to be an expert observer, or you don't have to be what I like to say is the judge, the jury. You don't have to know for certain. Right. I think if you just suspect as a good Samaritan that something might be happening, then it's important to call resources. So whether it's the Coalition for Domestic Violence hotline, whether it's our program, whether it's 211, whether it's 911, if it appears to be an emergency, the resources we would access if we suspected that something was amiss with anyone in our community. And I think in terms of reaching out to elders in our community, to just perhaps drop a card on their front step, maybe put a gift card in it, $25 to Stop and Shop, send cards, do a family activity where family gets together and writes nice messages, friendly messages, and maybe as a family, you drop those on people's doorsteps, or you send them to a nursing home facility because folks are so isolated. Maybe you see the person outside and you have a friendly conversation. Gee, these are different times we're living in. How are you doing? So I don't think it takes, lots of money or time or energy, but just, looking, listening, and sort of being that human connection.
And I want to challenge everybody that's watching, either now or in the future, to really, take what Cheryl just said as a takeaway and really make an effort to reach out to a senior that you know or that you don't know. As Cheryl's saying, sending cards to a nursing facility, or, talking to a neighbor you might not have talked to before. I really think that's something small that we each can do to really make a difference in a senior's life. So I challenge everybody to do that.
And we all love getting mail. That's right. Not that aren't bills.
Right. That's right, Cheryl. Actually, my good friend's great grandfather is in an assisted living facility, and it was just his like 95th birthday, and they couldn't visit him. So she just said to all of us, "Hey, if you have a moment, could you send him a card?"
Yeah.
And
Beautiful.
he didn't know us, but we sent him a card. So
Absolutely.
it can be as easy as that.
Absolutely.
So one of the things, one of the reasons, Candace, it's so important that you're on this segment today is because you really do play a crucial role in helping to train people in our fields about elder abuse and resources for elders through this Rhode Island State Victim Assistance Academy. So I think it is one of the places where people can get more kind of advanced training on this topic among many other topics. So we were hoping that you could just share a little bit about the State Victim Assistance Academy with our viewers and share how people can get involved if they're interested.
Absolutely. I'm so glad you brought that up because as Sarah knows, it's one of my most favorite things in the whole wide world. So every year we provide anywhere from 30 to 40 hours of training and professional development for victim service providers, advocates, pretty much anyone in the field, in whatever role they have, no matter how many years of experience or not they might have. We have everything from basic foundational information that we provide all the way up through advanced training, trauma training on, we used to call them special populations. Let's call them vulnerable populations. So LGBTQ communities, and also elders, of course, individuals with developmental or intellectual disabilities. So groups that are disproportionately impacted by victimization and repeat victimization, et cetera. The criminal justice process, start to finish, self-care, secondary traumatic stress. So it's a really, really robust curriculum presented by a number of experts, again, known locally, regionally, nationally. Typically, we would provide the academy face-to-face over the summer, but we're working on a virtual academy, hoping to have that launch towards a little bit later in the year, but we'll have more information available on FSRI's website and through any one of a number of providers who are listed in our resource guide. So I wanted to make sure I got to plug in really quick before we wrapped. So not only does the steering committee that we mentioned previously help to plan the academy and make sure that the content is current, relevant, and based on best practice, including practices and information as it relates to elders and victimization, the committee also put together this lovely guide, Rhode Island Victim Resource Guide. It's brand spanking new, and it has current information in it, current even in times of COVID. We just published this, I'd say April, May of this year. And within it is information on, I'd say, about 20 different programs and benefits that are available for victims of crime. So this is a great resource for anyone who has been a victim or survivor of crime, anyone serving them, any interested person, law enforcement, etc. So this guide right here is Cheryl's information, or her information about her program for St. Elizabeth. And again, up to 20 others. So there's contact information, what services and supports are available, who's eligible, whether they have various language capacity, etc. So this guide, I have hard copies of it. Folks can reach out to me, or they can get a copy of it directly from Family Service of Rhode Island's website as well. So between the academy and this guide, we're hoping that a lot of information is presently and will continue to be shared throughout the year with anyone who's interested in supporting someone who they either suspect or know to have been victimized in some way. So we can all work together to support one another and these individuals. So.
And after this, we'll share the link on our Facebook page so that anyone listening has access to your resource guide.
That's great.
Perfect. And I just want to point out one more thing is that, we are a statewide community program, and sometimes people think there's a cost attached to our program, and there's not any cost attached to our program, regardless of the service we provide.
That's wonderful, Cheryl.
Thank you. Well, thank you both for being here. This has been so helpful. It's been so informative. We were so, excited to have you both on and to talk about this, this issue that isn't getting enough attention, certainly, and is impacting our most vulnerable people in our state. So thank you both for being here today. We look forward, for all of you watching, we look forward to come back 2 Wednesdays from now at 10 a.m. to discuss more topics related to coping and wellness during COVID-19. If you have a particular topic you're interested in having us talk about, please leave it in the comments or send us a message on Facebook.
And please remember, if you or someone you love are struggling with managing stress or anxiety during this time, we want you to know that this is hard. We have clinicians who are here to assist you through telehealth services. So please feel free to give us a call. Thank you, everyone. Be well
Thank you.
and be safe.
And be safe.
Bye. Thanks, Cheryl. Thanks, Candace.
Thank you.
Thank